Hello, I'm Julie Thompson, and I'm a genetics nurse practitioner here at the Nassif Community Cancer Center. What I typically do is look to see if I can find anything out about their family history, whether they've had cancer or not. If they are a cancer patient, kind of where they're at with their treatment. Are they looking to have genetic testing because surgery is coming up, or are they in the middle of their treatment and maybe this is something that would help with treatment, things like that. So I kind of try and get a general picture of what the patient is going through before they actually come in. Before the patient comes in, we like to send them out a nice big worksheet for them to fill out. And this worksheet is about not only their own medical history, but honestly, more importantly, their family's medical history. So then when the patient comes in, we actually set out a big piece of paper and we draw out the family tree. So we are looking at both sides of the family. We look to see whether they're, who's had cancer, what type it is, how old they were when they were diagnosed. And that's help us sort of decide, does this family look like it might be a family that has a hereditary syndrome? So we talk through the testing and how that's done. And then we also talk to them, I think most importantly, about, okay, we're going to do this testing. So then what are the answers to those tests? What are the possibilities? Are we going to find something? Are we not going to find something? And then what do we do with each of those? Because we want to get people thinking while we're waiting for the results. How am I going to handle these results? How is my family going to handle these results? Who all is going to be affected by this? It's not just the patient, we're looking at the whole family. So then we go on to talk about the genetic testing itself and, what the heck is that testing? How do we do that? Is it, some people unfortunately can come in and think that it might be big and complicated like an MRI or a bone marrow transplant or something like that. And it's not. It's actually either just a saliva sample or a blood sample, depending on the test. So there are a couple of different aspects to if someone does genetic testing and it comes back that they do indeed have a hereditary syndrome. So the first person that we usually, of course, worry about then is the patient. How is this affecting them? And then once we get straight with the patient, then we start looking at the family. All right, so our patient has this hereditary syndrome. Who else in the family does this mean we need to look at for testing? Sometimes, of course, we'll get referrals from the oncologists who are treating a patient with cancer. Sometimes we'll get our referrals from the surgeons. Could be from other disciplines who are treating cancer patients like urology or ENT. And then sometimes we will get referrals from our primary care providers in the clinics. And then also we actually get quite a few referrals from the patients themselves. So if you're curious and you want to learn more about our services, or if you'd like to make an appointment, you are welcome to call us. So the Nassif Community Cancer Center's main number is 319-558-4876, and just ask for genetics.